We start this hour with the opioid epidemic.
That word, opioid, is now a staple of nightly newscasts, and the reports typically include images of prescription bottles and pills, implying that legal medications are responsible for that oft-cited number, 64,000 drug-related deaths per year, an epidemic, a crisis. Journalists dutifully and incorrectly recite that same misleading number.
Some people are asking, why are the news journalists reporting news that is not true? Why is CBS, CNN, and other news stations reporting fake news? What's in it for them, and why are they deceiving millions of Americans consumers by publishing news that victimize doctors and criminalize patients?
Pain expert Dr. Michael Shatman conducted his own survey during one 24-hour network news cycle.
And I put in one word, opioid. I got 75 stories. And every story had some combination of the words epidemic, overdose, abuse, death.
Dr. Shatman, an internationally known pain authority, has spent much of his life getting patients off opioids. He cautions against their use, except as a last resort, but says the numbers used to generate anti-opioid hysteria are both exaggerated and distorted on purpose. In a recent paper, Shatman wrote that the more conservative number, 16,000 overdose deaths attributed to legal prescriptions, is still a massive exaggeration. The most current, most accurate health statistics in the country are from New Hampshire, among the deadliest opioid battlegrounds in North America.
80% of the opioid deaths were due to, we'll say, non-pharmaceutical fentanyl. Because it is an analog of fentanyl, which is a prescription drug, it goes down as a prescription opioid death.
Here again we see that doctors are being blamed for overdose deaths that they had nothing to do with, and it appears they are being blamed intentionally. Why is the U.S. government and the DEA attacking doctors and calling them the drug dealers if patients are dying from drugs shipped from China?
New figures from New Hampshire show some 93% of drug overdoses were caused by either fentanyl or heroin or both. Across the country, the states with the most overdoses have seen huge increases in illicit fentanyl. Nationally, fentanyl deaths jumped 540% in a 3-year period. In western states, the illicit opiate of choice is still heroin, which is cheap, plentiful, and far more powerful than in years past.
Illicit fentanyl and heroin are the drivers of overdose today. Those are illicit opioids.
Social scientist Dr. Steven Ziegler says it makes zero sense for doctors to essentially punish and abandon chronic pain patients when more than 90% of opioid deaths are the result of addicts taking street drugs.
We're focusing on prescribers for a problem that is significantly being driven by an illicit market. So it's almost like we're arresting the wrong person. And when you arrest the wrong person, that means the real suspects are still out there in the loose causing harm.
Now we can see that the government is arresting the wrong people. They are arresting the doctors intentionally because they are controlled by Big Pharma. This is the war against doctors and pain patients that was waged against the doctors by CVS Health after they were caught up in the Florida pill mill epidemic. The doctors are being blamed intentionally by the government and the legislatures for an opiate crisis that they know is false. Why is Congress and state legislators doing this? The answer is simple: greed, power, corruption, and control. Just take a look at CVS Health, who is running all of the doctors out of business with their minute clinics, not because they have good service, but because they have lobbying power to pay off the DEA, the DOJ, the medical boards, and other government agencies, and they control the media, the same group of news journalists that have been lying and pumping out fake news to make the people believe that doctors are drug dealers and pain patients are addicts.
Lives are being lost in record numbers.
Nevada has seen a similar overheated reaction. An opioid task force was formed to lobby the legislature. New, stricter standards are being imposed on doctors because of what's described here as an opioid epidemic. The state's own numbers, however, show opioid prescriptions and overdoses have declined every year since 2011, except in one category: heroin deaths. drill down into the actual case files as reported by the Clark County coroner, and it's even more apparent nearly all of the deaths involve multiple substances, including heroin, methadone, methamphetamine, cocaine, and alcohol. And many of the dead also had serious underlying medical conditions, but anyone who has a trace of an opioid in their systems is counted as an opioid death.
A study came out just this year looking at the toxicology of people who died of supposed prescription opioid deaths. The average number of substances found in the system, including alcohol, amphetamines, cocaine, tranquilizers, generally benzodiazepines, was 6. We're not talking about 16,000 prescription opioid deaths. We're talking more about 1,600.
The drug distributors controls Congress and the government agencies that monitors and regulates doctors and control substances. This is a fake narrative created by fake news journalists who have conspired with Big Pharma to let the drug distributors take over the healthcare industry using nurse practitioners and physician assistants, and locking up all the doctors who dare compete with their businesses.